Health and healthcare of rural Americans. The current healthcare in rural America is very ineffective. There are many disparities rural Americans experience that their urban counterparts do not. The rural population tends to be older and sicker and are less likely to have health insurance. According to Alonzo, statistics show that 166 rural counties with at least 10,000 people have no PCP, that's no primary care provider, and are not receiving any preventative health care. Poor health and health care is a result of the lack of healthcare infrastructures, higher rates of risky behaviors, and lack of access in rural communities. When working with people, we use various theoretical frameworks to help guide our practice in social work. One of those theories that help is the contingency theory from a systems perspective. It explains that individual outcomes are contingent on a variety of specific situational factors. This helps to explain that poor health and health care in rural America within the contingency theory, within the contingency theory, the lack of infrastructure, the low knowledge base, generational poverty, lack of local resources, and the resistance to outside help are all specific to the reason of poor health care in rural America. There have been many programs in effect for many years to try and address the health disparities. The largest program has been the social insurance programs. This is a set of insurance programs that are administered by the government. The main programs that benefit the rural communities are the Medicare, Medicaid, and disability insurance. These help ensure people will have access to health care. But we see that the rural Americans lack that access. Since a large portion of the rural population consists of the elderly or aged ones, Medicare is the most important. Medicare covers approximately 62.6 million people and is the largest social program in the U.S., the largest social insurance program in the U.S. Next is Medicaid, as it is in place to help provide health insurance for the poor. The issues within Medicare and health insurance in general is for people in rural America, the lack of resources and income is that the costs can be expensive. In 2010, President Obama enacted the Affordable Care Act. That helped extend health care to over 32 million people and allowed for states to extend their Medicaid benefits, although some states did not extend those benefits, Alabama being one of those. Extending Medicaid would have helped so many people. The best way to overcome the many health disparities is to encourage healthy habits, offer alternative options to receiving care, and provide health fairs and preventative care clinics. By providing alternative options to receiving care, it helps close the barriers of distance and lack of access. Imagine having the Red Cross mobile clinic driving through your communities, monthly, providing the needed preventative care. Since the COVID pandemic, telehealth has become very popular, but not so accessible to rural Americans. In order to participate in telehealth, one must have adequate access to broadband internet. Many rural Americans lack this access. There should be provisions in place to expand coverage. Also, there should be some type of federal program that mandates the expansion of Medicaid. I hope this was very informative. I'm Farkita McCullough, signing off.